It gives me great pleasure to be able to talk about advanced prostate cancer because this is a stage of the disease that has changed so much in the 20, 30 years that I've treated prostate cancer. The backbone of prostate cancer remains the same, and this is with hormone treatment. And these are drugs which lower testosterone, the food of prostate cancer cells, and stop it growing. This is usually given as injections which last 3 months or 6 months and are put into the tummy 2 or 4 times a year. These injections will treat prostate cancer cells wherever they are. Now, you see fantastic responses to hormone treatment, but we've always known that after a few years the cancer can come back. And recently we've understood that there can be some resistant cells right at the initial time of diagnosis. And by treating right at the beginning with novel hormones, which will stop the cancer cells that have mutated, or with chemotherapy, that we can improve the outcomes dramatically. So it's been a real pleasure to go through this journey and see how we've moved along to now giving multiple treatments at the beginning with much better results. The treatments offered in advanced prostate cancer are usually very similar. Certainly age itself would play no part in deciding the treatment that you would have. I would treat a very fit 90-year-old the same as a fit 50-year-old. Comorbidities can sometimes help us frame the optimal treatment for each individual. As we look at the side effects of the treatment, we can tailor those to any comorbidities that an individual man may have at presentation. Generally, we have treatments that are very well tolerated. So access is open to the vast majority of people. And of course, it is always the patient's choice. My job is to go through the various options and their side effects. And it is always the patient with the support of their family that will make the final decision as to the best treatment for them that enables them to live their life to the full. The management of first-line advanced or metastatic prostate cancer is to bring the cancer into remission, to stop the cancer from growing and to treat the cancer that we know is there. And we can see the very beneficial effects of this by measuring the blood marker of prostate cancer, the PSA, and checking scans so that we can be certain that the cancer has gone to sleep. The main group of side effects from first-line treatment are related to hormone therapy. I think it's very difficult for many men to be told not only do they have prostate cancer, but to then be told that we're going to take away testosterone. And so I think it is vitally important at the first meeting and every meeting after that, that we work very hard as a team to reduce the impact of the potential side effects. Perhaps the most obvious side effect can be loss of erections and loss of sexual interest. And we have a whole team of doctors and nurses that we work very closely with who deal with andrology, who deal with, doing everything to maintain sexual functioning. There can be problems sometimes with hot flushes, such as ladies having the change of life, and we would treat those with various medicines and herbs, and sometimes acupuncture can be very helpful. There are metabolic effects. We would monitor cholesterol and bone density and blood sugar, and also to keep a very careful watch on psychological effects to really maintain quality of life whilst treating the prostate cancer effectively. There are many other side effects that can affect, different individuals, and we would be very certain to discuss all of those at our initial and subsequent consultations, and for you to feel free to bring up any problems that are bothering you so that we can do something about them.